因为我们做快递的是比较忙的，对新闻关注不是特别多。我们也是在12月底，然后经过小区的一些业主跟我们去有一样的反馈，就平常聊天嘛，会讲到一些这样的问题，就是可能有现在可能有一种国民肺炎的，或者大家发烧，让大家就注意点，相互小心一点。
A year ago, Song Yuwei's life was about to change. All our lives were about to change. Here in Wuhan, on the 8th of December 2019, the first patient was registered with the symptoms of an unknown disease, according to local government records. Later, we would learn to call it COVID-19. Many of the initial cases were clustered around this seafood market, long since closed, but only recently decorated.
This hospital is close to the seafood market, and this is where, as December wore on, people came with an atypical pneumonia. An atypical pneumonia that quickly became a public health emergency that became a pandemic.
Those early reports alerted Professor Chuang Yin-ching, regional commander for Taiwan's Infectious Disease Prevention and Treatment Network. He flew to Wuhan in January and met Chinese officials.
I think there's something wrong. The first thing, maybe they are not well prepared. The second one, maybe they are too busy or something they want to hide.
Professor Chuang was particularly skeptical of the official Chinese narrative that the new disease could not be transmitted from human to human.
They try to deny the possibility of human-to-human transmission, and then the higher official admitted that limited human-to-human transmission cannot be excluded. That means that is human-to-human transmission disease, for no doubt.
Professor Chuang made the call well before China and the WHO finally announced human transmission. He warned the Taiwanese government, which became the first to impose strict border controls and quarantines. Just 7 people have died from COVID there during the whole pandemic. And he tried to warn the world. A week later, Wuhan went into lockdown, the first of the pandemic, and, at the time, a radical, unproven measure. It was chaotic and scary, but it did not stop Song Yuwei working.
大家先是一个相互的一个借啊，比如我家油没有了，借点油。到后来呢，大家可能生活物资可能运不进来，可能不太充足了。
Wuhan has long since returned to normal life. But what started here has killed more than 1.5 million people in just 1 year, and it continues to rage around the world. There is still so much we just do not know. Tom Cheshire, Sky News, Wuhan.